As people struggle with the threat of the coronavirus, it's coupled with the stay-at-home order and economic uncertainty, which all takes a toll on our mental health. Barton Dieters checked in with experts to see if there's a growing concern in our area.
For reasons no one is quite sure of, springtime in Michigan means an increase in suicides. Now with COVID and the resulting stay-at-home mandate, people are worried that those numbers could rise even more. The worry that the COVID crisis could lead to an increase in suicide comes straight from the highest levels of government.
But you're going to have mental depression for people. You're going to have large numbers of suicides.
Locally, it's been something that mental health experts are watching. They're working to make sure that services are available to people, including health providers who are seeing the direct impacts of the virus. Barbara Hawkins Palmer is executive director of Healthy Kent and the facilitator for the Suicide Prevention Coalition.
And we do know in past economic downfalls where our suicide rates have gone up.
No one is sure why the spring sees increases in suicides, whether it's the fact that after the holidays they don't feel better or even the impact from allergy-caused inflammation. But statistics from the Kent and Ottawa health departments do not show increases since March 24th. In Ottawa County, there were no suicides in 2019, and there was one this year, the same as in 2018 and 2017. In Kent County, suicides have decreased significantly from 2019, when there were 11 suicides in the time period. And now there are 5 confirmed suicides with 2 suspected but not confirmed. The average in Kent County is 6 suicides during that time period.
Would any of that surprise you if there actually doesn't turn out to be an increase?
No, I just, again, feel like it's not in the closet like it used to be.
The state and national statistics are not available, but there's no indication of a spike in suicides there. In Italy, China, and South Korea, there are also no reports of increased suicides. But while suicides may not be going up, calls for help have increased.
We're teaching folks in the community about when to recognize someone who is at risk for suicide. We're just more aware, and I think we're making a difference.
Still, people need to be aware, according to the experts, including Marciala Alcia, who oversees suicide prevention and 911 outreach for counties in Southwest Michigan.
A lot of people are struggling emotionally. I mean, right now, having to not go out and maybe interact with families and friends, insulation is not helpful in times of when you already have anxiety or depression.
We have lots more information and links to where you can get help at woodtv.com. In Grand Rapids, Barton Dieters, News 8.